Okay, it's April 3rd. I'm with Dr. Brad Gray in his office, and he's going to explain to us the extent of Freddie's injuries and what he's going to do about it to correct them. Go, Brad.
Okay, so these are Fred's x-rays. He's apparently had some bad luck over the years. Hard to tell how long he's had the problems, but he has probably both back legs. In one case, this is his left knee, and his left knee is actually perfectly fine. This is what a normal knee looks like. This is his right knee, and his right knee, you can see the difference between the two. One glaring difference is that little white spot right there is a BB from either probably a shotgun or even an individual BB shot. What Fred cannot do is he cannot extend his knee. So he cannot straighten this knee out. It's impossible.
Okay.
And I'm assuming it's partially because of this BB in there. And you can even see that he has a lot of arthritic changes in comparison of the knee because of disuse, and there's actually bone and cartilage atrophy going on. I'm hoping that by removing this and exploring the knee joint, seeing what else we can find in there, that we can help return his mobility of the right knee.
Oh, that'd be wonderful.
Yeah, so his left knee is fine, right knee is not fine.
Okay.
And then, due to awful bad luck and fate, both of his back legs are bad. His hip on his right side, the one where he has a bad knee, is actually, it's hard to see in this view, but normal. And here's another view of it here. Because we could not pull his legs straight out.
I know, they're like glued together.
Yeah, they don't bend properly. You couldn't really get a proper view, but it's enough to see that this hip joint here is fine.
Okay.
So he has a bad right knee, a good right hip. He has a good left knee, but a bad left hip. And what he's got going on here, and you can see the difference right here, all of this fuzzy stuff.
Right.
What he basically has is apparently it had a fracture. And the way the fracture is healed, this is calloused. And what it is that basically his hip is fused. So he can actually flex this side a little bit, but he cannot extend it at all. So because of the mechanics of the hind limb, he just can't use his hind legs. That's why, because he has a bad knee on one side, and he has a bad hip on the other side.
Okay.
So we're going to remove this and explore the joint and see what we can see. I can't tell at this point. It doesn't appear that he has a cruciate ligament tear. I'm not sure what damage the BB's done, but we're going to go see.
Okay.
And then with the hip, what we're going to do is something called femoral head osteotomy, which is actually we're going to detach the femur right here, try to clean up this joint as best we can, and then a false joint will form, which has no pain receptors in it, and it's more like a callus, fibrous adhesion, and hopefully he'll regain the use of that too. So we have to decide in what order we're going to do these things, and it's going to be coupled with a lot of physical therapy. The one thing, maybe the hardest thing for him to overcome, is he's been so used to walking on two legs.
Right.
That I do not know how long it's going to take him to go, hey, hi, my back legs work again, and maybe I can actually use them.
Yes.
So that's going to be kind of a breaking of a habit.
Right.
So we have to pick, I'm not sure quite yet, I have to think a little more carefully about if we want to do both procedures at the same time, or do one and try to get him to use that leg first and then go to the other.
Okay.
So we're going to see. But right now he can't use either of the back legs, so physical therapy for him without at least one surgery would not be helpful at this time.
Okay.
Okay? So
But this is as bad as it gets as far as
it's pretty bad. I've certainly never seen anything like that.
And that he learned how to walk, to hold his rear end up the way he does?
That's very compensatory. That's a big word.
I know, that is a big word. I know what you mean, but that
Yeah.
is amazing that he learned how to compensate for that. So how long do you think this has been? Months? Years?
At least a year.
At least a year it's been like that.
Yeah, that's a lot of callus formation there. If you saw this on another dog that hadn't had a fracture, you might think it would be a bone tumor.
Really?
But I don't think, based on his presentation and the way it looks, that it's a tumor. I think it's callus. I think it's healing bone, but in an abnormal way.
Okay.
Okay.
All right, so you're going to take the BB out.
Take the BB out.
Is that the only BB he has? Remember when we
He
had
has a very small one right here, but it's not involving bone or anything. I'll
Okay.
probably leave that one alone. You can actually see it right here.
Right.
But this is the big one
Mm.
right there.
And he's so sweet.
Nice guy.
He is a nice guy.
Yeah.
All right, well then we're going to start surgery, and we just wanted everyone to know, and you've all heard about Dr. Brad Gray at the Brandywine Vet Hospital in Chadsport, who takes care of all of our dogs, especially our broken dogs. But here he is in person. There he is. Say hi, Brad. He's cute. He's so cute.
Camera show.
He's the man that takes care of our dogs, and
We'd like to help.
we're up to 11 dogs now that Brad has fixed. And I'm very happy that we were chosen to take care of Fred, because we knew Brad could fix him. Okay? That's it, guys.